Sabrina, you were amazing at the CIT International Conference. Was that in Indianapolis?
It was, yep.
And I understand, I heard a rumor that Paul Galdus took his shirt off in one of the presentations.
Yep, he did. He had this really cool mental illness is not a crime t-shirt, but he just couldn't get up on stage as a keynote in a t-shirt. I don't know why. You do it all the time.
I do it all the time.
So the compromise was he would wear the shirt, the tie, the jacket, and then gradually unveil the t-shirt. But he's stripping to unveil the t-shirt.
Did he just like flex and it all just popped off, or?
That would have been awesome.
Well, when Sabrina first mentioned this, I had visions of our new Health and Human Services Secretary, Robert Kennedy. Yeah, RFK. In that, have you seen that shirt with him? Where he's got he's fit.
Is he?
Yeah, he's really buff.
So yeah, it's just his brain that has the worm.
The
rest of his body, but no, I'm just glad that Paul doesn't also have some really cool 988 underpants that he had to. So the shirt only.
If Paul and our RFK are shaking up healthcare, let's wait till we hear from our guest, Sabrina Taylor. So let's get the show going, John.
Let's do it.
Welcome aboard Lifelines with David and John, your guide to charting the transformative course of crisis intervention and the game-changing 988 Lifeline.
So welcome back to Lifelines, the 988 podcast with David and John. My partner, Brooklyn, I've been working with for all these years, but we've also had an enormous opportunity to collaborate with and work to coordinate a system of care for crisis in Phoenix with our guest today that we're so thrilled to be with. So, John, tell us a little bit about Detective Sabrina Taylor.
Oh, yeah, David, it is fantastic to have Detective Sabrina Taylor with us today, who spent her last 22 years doing police work. And correct me if my estimates are wrong, Sabrina, like the last 17 of which has been a member of the Phoenix Police Force, where you've also been their crisis intervention team coordinator for nearly 9 years. Is that about right?
That's about right.
Yeah, and you've served, I think, a maximum term of 6 years as an executive board member of CIT International. You're also the co-author of their 2019 Best Practices Guide, and you've also co-designed many CIT programs and trainings, is what I'm understanding. And I am thrilled to have you here as a leading international expert in behavioral health trainings, police officers. So please welcome to our podcast, Sabrina. Good to see you.
Thank you, guys. Thanks for having me.
So, Sabrina, we want people to watch and like and subscribe on YouTube or wherever you get your podcasts. But we want them to know a little bit more about your personal life as well and who you are as a person. So we have a segment we start that we call the Super Fan. I used to be a super fan of the Dallas Cowboys until the last 30 years, John, unfortunately.
Yeah. And I mean, so that's back when they were winners, and that's why I'm a super fan of the Chiefs, who are mostly winners.
And when did you become a super fan of the Chiefs, John? Like 2 years ago?
When my wife got me into Taylor Swift, and my daughter especially. Yeah.
Well, watching the Kansas City Chiefs right now, not this weekend, but is normally like I used to enjoy watching the Cowboys because all they do is win. But the issue here today is what is Sabrina a super fan of? So, John, you and I both have a blank sheet of paper.
Yeah, I mean, this is going to be a wild guess.
I'm going to have a wild guess too. So, what is Sabrina a super fan of, John?
All right, hold on. I got my blank paper here. Just hold on. Give me a second.
All right, I'm just making a quick note here.
Yeah, and David's notes are very quick. They're very scratchy. It's going to be hard to read his.
Wait, I need a red and a blue.
They're going to be very easy to read.
All right, now I'm good now. I'm good. What you got, John?
Yes, Sabrina.
Let's see.
So here we go. You ready?
Yep, I'm ready. Bicycling,
Why do I only guess that because
Cop Spike, is that it?
well,
No?
she's you're into mobile work, and it's like what do people who like mobile work like to do in their spare time? Do something like exercise on something mobile. Go someplace, but not as nearly as much of a hurry as you are in a cop car. How far?
Okay.
All right, so
I was thinking horseback riding.
yeah,
Right?
let's let Sabrina pause that. My guess is from her body language is that one wasn't a tight fit. But my first thought, Sabrina, I'm also going to guess here. My first thought was to do trail running, which is, but the problem is I did that for Sarah,
Right. Yeah.
and in fact, I think it's the same silly trail. Is that the Arrowhead Loop Trail? I
Oh,
think.
that's just a road.
Yeah, I think that might be a trail that Sarah hikes and runs as well. But anyhow, I said you're a super fan of buddy cop movies.
Oh,
Isn't that amazing how he just did that in seconds?
You know, like Bad Boys, or how many buddy are you? Are either one of us warm, Sabrina?
not really. Good. I was curious what you'd find because I think the only thing on Facebook are pictures of my dog.
There's a lot of you doing running stuff, though, Sabrina.
Yeah, so you can blame Sarah for that. She happens to be my neighbor, and she invites me to things, and I have no boundaries. So I just say, that's a horrible idea. What time?
So you're not a super fan of that either.
No.
So your dogs, tell us about your dogs.
Well, I have one dog that I adopted from my boss, and he's a little Chihuahua mix. And he's adorable.
He is adorable. I saw him on your Facebook page and got nothing else from that. Not that I'm trolling, Facebook, but just.
So, Sabrina, you're a mom, you're a student, you're a detective, you're a wife. Tell us something that you're engaged in outside of work and study and family.
I mean, that's a lot of it. School takes up a whole lot of time. I'm in a book club.
When you have time off, what do you like? Oh, this is what I really want to do.
Mostly I find some kind of trashy fiction and dive in.
Okay, so books would have been a pretty good bet.
Yeah.
Mm-hmm. Yep.
Well, we're so glad that you're here today. And we also appreciated you traveling to Amsterdam with us for the Crisis Now 3 Summit. But Sabrina, you've been all around the U.S. and around the world doing this work, and we're gonna dive into it. But John, before we do that, let's get a word from our sponsor, Behavioral Health Link, and its crisis software platform that brings us this podcast.
Yes, David, Sabrina shares our passion for minimizing law enforcement exchanges with people in behavioral health crisis. And one way to make that happen is to assure a rapid response for people in behavioral health crisis, whether it's CIT officers or civilian mobile crisis teams. And Behavioral Health Link's GPS-enabled mobile crisis response software assures that the nearest mobile crisis workers can respond to people in need no matter where they live. The module's features also allow for assessment information from the hotline call to be available to responders so they can see what the prior conversation is and factor that into their current assessment. It also helps them stay safe because it provides additional safety information and alert features to protect the workers from going into unsafe situations. So if you want to learn more about BHL's industry-leading mobile crisis dispatch software and our other technologies revolutionizing community crisis care, just check us out at behavioralhealthlink.com. David?
So, Sabrina, we want to jump into the good news, which is our segment highlighting the positive leadership and work happening in the crisis space. And there's so much we could tee off with your work. Videos from the Phoenix Police Department have been done recently. John, this is looking out at the city of Phoenix, but so many different videos that highlight Detective Taylor's work with the Phoenix Police CIT and her leadership in that area, as well as that of Phoenix. But I think that where we'll go today is to talk about the CIT International Conference that was held, and you brought into the Crisis Jam, Sabrina, which you've been doing a few years. But tell us about the convening, why it's important, and the impact that that conference made.
Well, I mean, I love the conference. I've been a part of it for a long time, but it brings together law enforcement and providers and people with lived experience, and the distribution has been getting pretty good. It started out with a lot of law enforcement, but now it's about almost 50-50 between law enforcement, behavioral health providers. And of course, we usually get NAMI helps by sponsoring a lot of people with lived experience to come to the conference. And so it's a chance to get together and talk. And I hear often that it's one of the friendliest conferences that people have been to, that people are very welcoming and open to ideas, which warms my heart. I'm happy that we're able to provide that for people.
Where will you be next year?
Anaheim, but not that far away.
Terrific. John, have you ever been to one of the CIT conferences?
No, but if you're saying it's filled with friendly people, why wouldn't I want to go? I mean, that sounds great. That's the first time I've ever heard anybody describe a conference, starting first with everybody is so friendly. It's great.
How far back have you attended, Sabrina? My first was, I think it was the third one in Memphis back, had to be 20 years ago.
Wow.
How long have you been attending?
Since 2015 in Chicago. So not that long, but.
And have you been to every year?
Yep. Every year since.
Are they getting bigger and better?
They are getting much bigger. Every year we grow, and we're starting to run out of hotels that can hold us.
Right.
But we're not quite big enough for like a convention center yet.
Yeah. One of the things that you were talking about, the 2015 was the first one you went to, and you've been doing 9 years for the CIT coordinator. And I'm wondering about your journey, how you got from, first of all, wondering how you got to become a police officer. Where does your passion for policing come from? And then how did that lead you to kind of behavioral health police work in CIT?
So the first is a funny story. My undergrad is in aviation, and I was a flight instructor.
Oh.
Yeah. And then I had one of my last students was an LAPD officer who was an observer in their helicopter. And to make that promotion, he needed his private pilot's license and 100 hours of flight time. So I was getting him his time, and he's like, "Hey, what are you doing next?" I'm like, I don't know. And so he said, I think you'd make a great police officer. And I said, no. And he's like, well, look into it and give me a real reason why not, because you'd be really good at this. And when I looked into it, I realized that it looked like a pretty good job. So I did it.
What did he say in you that said, I see police officer in you? What do you think?
Yeah, exactly.
I mean, I'm very, I guess, very willing to go along with anybody who'll mentor me. This is why I'm getting my PhD, because somebody said I should do it. And so I'm doing it.
So he didn't say bicyclist when he saw you. You look like a bicyclist, no?
No, at the time I did have a road bike, and it was about 12 miles from my apartment to work. So I would ride my road bike to work, but I haven't owned a bicycle since, and that was like 20 years ago.
So how did you go from becoming a police officer to saying, did somebody else look at you in the police force and say, hey, you would also be great for CIT, or was that something coming from you? How did that happen?
So a little of both. When I moved from Los Angeles to Phoenix, and I was going through training all over again, my training officer, I would say, well, this is how we do mental health. And my training officer would say, yeah, you can't do that. And I'm like, I call BS on that. I don't think you know. So at the time, Nick Margiata offered the CIT classes here in Phoenix. So I went, and I was a little right, a little wrong. There are some things that you can do in California that don't fly in Arizona. So I was wrong on a couple things, but, and then, so Nick started, offering me opportunities to do things.
Yeah.
And so I generally find this topic interesting. I was generally impressed by the opportunity to make a difference. And Nick was just very supportive and needed a lot of help. And so that was a little bit of both. It wasn't all Nick, but it was a lot of Nick.
So you became partners in the good. That's great. Not partners in crime, but partners in the good. Great.
Nick's tenacity is like nothing I've ever seen. So, Sabrina, we've heard a little bit about your background of how you got into policing and into crisis work, but you referenced a PhD. Tell us about where that's going, and where are you going with it, and what do you want to do with it?
So I'm not sure what's going to happen when I'm done with it, but I really appreciate the classes. They're like social science classes, and they cover a lot of exploring how systems work, including healthcare systems. And so it's really helpful for the work that I'm doing now. It allows me to sort of really pick apart CIT and understand why it works, and why it was designed so well in the first place.
Yeah.
And I wasn't sure going into it if it was going to hold up, but it does.
Yeah.
So it's a PhD in social sciences, or what is it in?
So it's really hard to describe. Academics will know it as a science and technology studies degree. ASU gives it another name just because, but it's like a multidisciplinary, the social sciences kind of a degree.
Oh, it's exciting that you are totally into that, and who knows what the next phase of your career is going to lead to, but it sounds like big ideas are to follow.
I'm hoping.
Sabrina, so John was referencing you're engaged in the best practices toolkit back in 2019, and now you're getting your PhD. Who have been your other influences? Certainly Nick, but I'm thinking Michael Compton or other people like that. Have you worked with those individuals, and who have been your other Nicks in your CIT journey?
So ASU happened to lend a person to the mayor's office here in Phoenix. And she has 2 PhDs, one in nursing and one in the program that I'm doing. And while she was here with the city of Phoenix, she was able to do really cool things and help with the launching of the fire department's behavioral health program. And she's the one that convinced me that this would be a good idea.
Yeah.
So her, but yes, Michael Compton and Amy Watson are currently working on another study in CIT. And so Phoenix was able to be a test site for them last year. So I do enjoy working with them too.
So Sabrina, we've had Amy on the Crisis Jam. Have we ever gotten Michael? It seems like we've tried many times, but I'm not remembering that we have actually ever made it all the way to the finish line.
I don't remember seeing him. Another really good one is Rebecca, and I'm not going to be able to say her last name, but she's with the University of Chicago, and she's written a couple papers with.
Yeah.
Okay.
About the history of 911 and yeah.
Yeah. Great. Okay, so Sabrina, this brings us to our trivia portion of the program, and I'm reflecting back on my first CIT training. There were 17 of us from the city of Atlanta, mostly law enforcement, but several of us behavioral health who traveled to Shelby County back in 2004 and went through that training. And while we were there, we went through the same training the cops go through, and at that time it included firing it looked like a Gatling gun to me. It had these huge canisters, but it fired a projectile, a less lethal projectile kind of. I don't remember what that weapon was called. I don't even know if they still use something like that, Sabrina.
Yeah, we currently use something called a 40 millimeter. It's like a big giant blue rubber bullet.
Yeah. And essentially the way they described it at the time is if just the act of pulling that out of the trunk if somebody had within them the wherewithal to get themselves under control, they found it when they saw that, because it looked like it was just going to blow a hole through you. But that idea of less lethal means at the time, 2004, I think there were only about 8% of law enforcement who deployed a taser. And at the time, there was still a lot of controversy around unintended consequences, a heart impact, or something like that. So our trivia question for today is going to go to John. And Sabrina, you get the chance to say over or under. So, John, I gave a little bit of a baseline in that only 8% of law enforcement had in their possession a taser back in that time frame when I first went through. But in 2019, more recent date, the New York Police Department for the year reported 52 incidents where officers intentionally discharged their firearm during some kind of adversarial conflict. So during the line of duty, outside of training, they actually used their service revolver 52 times for the very large New York Police Department. That same year, John, how many times did officers deploy a taser? So they'd have to have a taser and then they'd have to deploy it. So 52 times they used their gun. How many times did officers use a taser?
It's a great question. I mean, because it also, I mean, all officers have a gun. Do all officers have a taser? You were saying 8% had 4. And I would say they would all have a taser in New York City.
So you think, John, it's changed dramatically over the last 20 years? The controversy may be still there, but these are tools that you think most law enforcement have today.
I do here in New York City. That in their trunk at the very least, that it's in the car that shows up.
Yeah,
it's not actually on them, but probably is on them to some degree. But I would say, for you say 52 times a shot was fired, I would say, I would multiply that. I would say 500 in the neighborhood.
500. Okay, so you think it's much more common for tasers that in today in actual practice. So we don't hear a lot about that, John. And let's see if that's a good number. Sabrina, the New York Police Department fired a service weapon 52 times. How many times did they fire a taser or utilize the taser? John says 500. Was it more or was it less than 500?
500 is a pretty good guess. New York has got the biggest police department in the country.
Yeah.
It's 10 times the size of Phoenix.
Yeah.
So at the risk of being over, I'm going to say maybe a little bit more than 500.
So the answer is over, but it's way over.
Yeah.
Way over, Sabrina. So you win. All you had to do was catch the right direction. And John, you went way north. I mean, if I had been asked this question, I'd like to say,
actually thinking going higher.
I'd like to say I would have gone 500, but I can't imagine that I would have, because I remember how the last time I had this conversation in earnest was being in that Shelby County Police, and tasers were still a concern. I think that's the reason they were training us with that other projectile nuclear bomb, grenade launcher thing than the taser. But over the course of time, most law enforcement now have tasers. The vast majority do. And the actual number in New York City in 2019 was 2,365 times they used their taser, as opposed to 52 times that they used their service weapons. So, Sabrina, reflections on that. Sabrina, you carry a taser.
Not anymore, but yes, I have. Almost every patrol officer in Phoenix has one.
So you don't carry one anymore. Tell us the rationale, the thought, and what do we see in Phoenix? Do we see them used routinely?
Yeah, I haven't seen the latest numbers, but they are used far more often than firearms. I mean, they're handy. They're with everyone. They're less lethal. There's still concerns. There's still restrictions.
Yeah.
But definitely we use them a lot.
Well, Sabrina and David, what I'd be really curious to know is that as tasers go up in terms of most cops having them, are the discharge of firearms going down? And I wonder if there's data that shows that as we have more tasers, we have fewer shootings. I don't know if there's any data that shows that.
I haven't seen anything, but I haven't studied that super well.
So the other thing that I came across just in that brief look was a tool to basically gain control, I guess, of the individual without this is the bolo. What is it called? Sabrina, does this ring a bell at all? This it sort of wraps around their waist or their legs, depending on where it's fired.
Like something Batman would shoot out of.
It looks like something Batman would shoot.
Yeah.
I mean, the technology is getting to be incredible. The amount of tools that are out there now, there's a lot. And they all have pluses and minuses, situations where they work and don't work. And so every department has to sort of make a decision about what they're going to buy and when they're going to use it and how they're going to use it.
Yeah. So these are the challenges of day to day, Sabrina, of being a cop and being out there in the real world with the pragmatics of someone who is threatening themselves or someone else or the cops themselves. Sabrina, one of the things that I remember hearing from Nick over the course of time with CIT was orienting the behavioral health workforce to cop culture and the realities of being a cop. We in behavioral health always want the cops to understand our world better. What should we, Sabrina, understand about your world and the world that officers work in day to day?
Oh, there are a couple of things. I think the first one is that most officers really just want to help someone, but the tools that they have at their disposal are a lot different.
Yeah.
And one of the challenges that I see a lot, like that people don't understand, is we're subject to the restrictions of the Constitution. So where it says you are free from governmental searches and seizures, well, I'm the government. So there's a lot of things that people think that we can do that we can't because we have to respect somebody's constitutional rights.
Right.
Yeah. And, David, that when I worked with New York City cops back in the day, we had all sorts of good ideas that they agreed with, that they would say, yeah, we'd like to do that, but, put that in the patrol guide. Otherwise, I'm not going to be able to do it. And that was one of the things that we learned, is that if we wanted to make changes, they have to be in the patrol guide. They go by the book. And that's back to that, we also go by the Constitution, that book as well.
Yeah.
That whole thing, and this is what we certainly learned here in New York City, was how important working with the police was, and they were also how important it was to work with us. And those community partnerships are so crucial. I think Sam Cochran said that CIT is not just about training; it's really about community partnerships. That's really what makes it effective. And I know that that's true of you, Sabrina. You are really all about community partnerships. And I'm wondering, in Phoenix, what are some of the most vital community partnerships you think that have been essential to really making it effective? And perhaps is this also true of other places?
All of them.
Yeah.
I mean, when we really start to look at trying something new, the meeting gets big fast, because you definitely want to include the providers of services. You want to include your community. You want to include people with lived experience, because for officers, we're not just serving one client, one patient. We have to keep in mind the community that they affect. Like their neighbors have something to say about how their symptoms are affecting life in the neighborhood. And they will be vocal with the city council about that. So we have to think about everyone when we respond to behavioral health crisis, not just the person in crisis, which I sometimes think that that's a luxury providers get, is you just have to worry about the person in crisis, where I have to worry about everybody else.
Yeah, we're trying to protect the community, so we need the whole community's input here. And I wonder if there is a partnership that has recently occurred or has been leveled up in some way that has really kind of supercharged the CIT program. Is there anything, I think you all worked with Solari, or is there what any in particular that like, wow, that is a game changer?
Well, Crisis Now is a game changer. It's fun to partner with Crisis Now. It is fabulous to partner with 988. I think the most revolutionary thing we've been able to do since 2020 is just the 911 to 988 diversion.
Right.
And it was always possible. Nick always said it was a possibility.
Right.
We just hadn't been able to break through and make it an actual thing in policy, which just because of the way that events have transpired, we've gotten the attention of management. We're able to codify that policy and make it a thing. So, and that has been very much a system disruptor in a good way, I think.
Yeah. Terrific. So Sabrina, we're going to shift into a segment we call the Crisis Rapid Fire. And that first trip to Memphis back in 2004, I spent that third shift in a patrol car and asked the officer what was challenging. And he said that the behavioral health crisis intervention was not challenging. He had great training. He knew de-escalation. They had some resources available. But he mentioned two situations that he thought were the most stressful. And I'm going to go through stressful situations of a cop. And just your brief reaction to you've been there, and maybe give us a little bit about it. So first one, officer down.
That's rough. That's horrible.
We actually were on shift for one night, and we had both that night. We had officer down. There were two officers serving a warrant in a part of Memphis, and they were shot through the door. And all of us, the 17 of us, every car that we were in across the city just went, just went. So that one was, and I remember hearing it. You start hearing it over the radio in real time, and just how your pulse and fear for those officers and everybody converging on the scene. It was striking. The other one, Sabrina, that he mentioned and also occurred to us that night was a burglary in progress. Well, there's a breaking and entering, and you're not sure whether the person is still on the premises or not. So you're going through with the anxiety of whether they're still there.
Those are fairly common.
They are.
Believe it or not. At least in Phoenix and Los Angeles, big cities, they're fairly common. You get to know your area pretty well. In certain parts of the city, they're almost never real. In other parts of the city, they almost always are. It's always a little nerve-wracking, but you get used to it not being the case a lot of the time, where the person, by the time you get there, the person's gone, even if they were there.
Yeah. So when the officer left me in the vehicle, and this is the middle of the night, and I'm still in the vehicle, and he's gone by himself inside, and I'm there by myself and thinking, what? And then I realized he's got this shotgun that's upright, and I'm like, how would I get that out if I needed that?
That was the first question Joel Conger asked me when he went on a ride along, and I didn't have a shotgun. He's like, how do I get to that?
Sabrina, an active shooter situation. That one did not occur that night, but is that something that you've been a responder to?
I don't think I've ever responded to that. The others, unfortunately, yes, but I don't think I've ever responded to that. You train for it, you practice for it, but I've heard presentations from officers about who have been in like the Pulse nightclub shootings, and I just can't even imagine that would be a lot.
Right.
Domestic violence calls. I'm assuming these are one of the most common, much more than breaking and entering or that kind of thing.
Those are pretty common as well. Mm-hmm.
And exceptionally challenging. What is this like on a?
I mean, they can be anywhere from routine to challenging. I think the hardest part, one of the hardest things for officers is with 911 being a default, we get called to a lot of situations that people are unable to handle on their own, but we don't necessarily have the ability to support them.
Right.
You might get an officer who's 21 years old, still living at home with mom and dad, and
Right.
you're calling him because your child won't go to school. So,
right.
Yeah.
We certainly want mobile crisis to respond where it's possible, but there are suicide attempts or a suicidal individual where by nature of the intent, a weapon, et cetera, the first response does need to be law enforcement. What are those like, and how frequently are you on the scene of that type of situation, Sabrina?
I think that situation happens a lot, especially because when the calls come into 911, they come in as a crime because people are having hallucinations that people are breaking in, or part of the delusion is that someone's stalking them, or maybe it's causing some family dynamics. So oftentimes crisis calls come in like crimes. And it's not until the officer goes out there and sees what's happening that they realize, oh, okay, now we need a mobile team. So, while we can try to think a lot about co-response, and it's always a little tricky. Does the mobile team wait for police? How dangerous is it?
Yeah.
A lot of, what we still have after 911 diversion is stuff that comes into 911 that doesn't sound like crisis, but then it is.
Then it is. The cases involving children or calls involving children, are those common for you? And what do you think about on those calls, Sabrina?
They're common and they're really tricky. There's, in Arizona, we can't involuntarily petition children. The way the state looks at it is if the family says that they need assistance or they need to go into a hospital, then the family just brings them and they're in the hospital. But, some of these kids are big. Sometimes families aren't comfortable doing that. And then without a petition process, law enforcement has very little ability to help. Mobile teams are saving us in that respect, but they're common and they're tricky. When possible, we just try to transfer everything to 988.
Yeah, there you go.
Sabrina, I have one to add too. And obviously with CIT officers, it's really great to be able to establish relationships with people in the scene who are under a lot of stress. But I'm wondering if you ever have gotten called to a scene where you actually knew somebody from your personal life who was involved.
I've purposefully chosen to work in places where that would be really difficult.
Yeah.
I have, on my off-duty time, had to help family members through the process. So I've seen the system from a personal lens as I'm trying to help family navigate through it. But yeah, fortunately, that's never happened.
That's more likely to happen in Mayberry, I guess.
It's happened to some of my friends, but I purposefully, I grew up in Massachusetts, so I didn't grow up with anybody here.
last one I'll reference from this list, traffic stops on suspicious or dangerous individuals, Sabrina.
Oh, traffic stops we do those all the time.
And what's your reaction in those types of situations? How do you think about those?
You do get used to them, but you get used to them going a certain way. And when things don't go like normal, you get a little nervous. And some people don't understand. And you generally have to do a lot of talking and explaining cop culture to the random person you stopped over. But whenever something goes different, we get very nervous because it can go bad so fast.
Yeah. So Sabrina, pulling back to the CIT program, and Phoenix has a remarkable system because of that partnership with behavioral health and so much more. As you look out at the nation, or even, again, you facilitated that panel that we had in Amsterdam, who do you think about as other marquee programs out there that really have something to offer that we should be learning about?
Oh, gee, there's some good ones out there. I think a lot of different locations each have their little niche that they're good at, and I usually learn a little bit about something from everyone. And there are a lot of universities that are partnering with different police departments right now. Like Yale is partnering with a police department in Connecticut. Berkeley is partnering with a police department in Austin, and some of the research that's coming out of those partnerships has some interesting information in it.
Yeah, that is interesting. Because I'd be curious to see it, and I know one of the things that CIT, like all these programs, are looking for is, are there data to show that this is effective, and how we can do better. And that I'm curious, is that an area that you're interested in? And have you seen data that really does suggest, a person who's now very much in academia, is that something that you've been pursuing, is data? And have you found data that has been really persuasive to you?
So that the interesting thing is there's no data that's persuasive. There's actually, my favorite academic paper says that CIT is a blindly adopted novelty.
Yeah, interesting.
Michael Compton and Amy Watson are trying to prove that it works, and they're doing the first randomized control trial. But right now, the data for this stuff is all over the map. So, I mean, what I'm finding is, going back to solid, like, social science processes, like in anthropology and sociology, and that have worked in other places, and adopting that and crossing your fingers. But yeah, the data is sort of hard to pin down.
Well, and it sure makes sense. Kinder, gentler policing who understand mental health issues. Why wouldn't that be more desirable? Why wouldn't that be better? But it does sound like that's one of the things for the future that we'll be looking for. And you mentioned earlier that 988 has really changed CIT, and it's really grown considerably. I wondered if you could say a little bit more about that, but also what you see 10 years from now. What are you hoping for or imagining in the next 10 years for CIT based on growth and needs?
I mean, I'm hoping this momentum with 988 continues, because I think as a nation, we're imagining things that we never thought possible before. And so, I'm imagining alternatives to police, as in like alternative transports.
Yes.
We started to explore that in Arizona. We actually passed a law making it possible. But when we were looking into it, no other state that we could find was doing it. Virginia was trying, but not having enough success that we could model. And I'm hoping to start working with my stakeholders to see, can we imagine this? Because people are having difficulty just imagining that happening and happening safely. But I think we're at the point where where we need to imagine a different world, and with even less police in it.
It's so necessary, Sabrina. When in the years I was working on the mobile crisis team, and in those unfortunate circumstances where we did need to call the police and that the person had to be taken to the hospital, it was, first of all, overwhelming to have a lot of police on the scene. But the worst moment was always when the individual had to be transported and they were handcuffed and put in the back of a police car like a criminal. And that was hard on everyone.
Well, so how often are law enforcement engaged in transport, Sabrina? How often is this occurring?
Thousands of times a year. And just from one hospital to another in Phoenix, at least 1,400 times a year.
Yeah.
And that's from a secure hospital setting to another secure hospital setting.
So the police are involved in transport, and they are handcuffing individuals routinely by protocol, putting their heads down into the back of that police car. Feels like I made the statement to Sabrina one time, John, that it feels like an arrest, even though they're not being arrested. And Sabrina,
Absolutely.
you said, not so fast, David. So give your answer to that and why that is.
Well, I mean, it definitely does feel like an arrest, but that it, as far as the Constitution's concerned, it's different, right? Like police use of force, as outlined in the Constitution, is based on the severity of the crime, and we don't have a crime. So it gets a little hinky. And, police cars aren't anti-ligature. The people that we're transporting are either a danger to themselves or others by definition.
Yeah.
And so the only way that we can try to keep them safe is to handcuff them. And that's not helpful.
Yeah.
Sabrina, I'm interested in your reaction. We have arguably in Phoenix the marquee. There are issues to work on, but I'm not aware of anyone in the country who has the robustness. Well over 2,000 mobile crisis engagements every month, of toddlers up to seniors. These are occurring in people's kitchens, in their apartments, under bridges. And when that happens, law enforcement isn't involved at all. And any other community around the country might require a police on the scene. We have 2,000 times every single month that police are dropping people off at community bridges, connections, recovery innovations, et cetera. They didn't take someone to a hospital. They didn't stand up against a wall for 4 hours. There was no medical clearance. So there's some remarkable aspects, the Solari 988 coordination, and yet the Department of Justice identified Phoenix as one of the areas that it was concerned about practices. So your reflection on that sort of juxtaposition.
So without getting myself in trouble, because there's pending litigation, there's not I'm allowed to say.
Yeah.
But what the DOJ has consistently said on the 988 Jam and at CIT international conferences is that, it's kind of what we're hearing coming out of the National Institutes of Science as well. Like parity is something that everybody's interested in right now. And, the way that we as a nation treat and pay for and operate in the medical health space is way different than what happens in the mental health space. And, people are fed up and yet we haven't been able to change it yet.
Yeah. So last thing, Sabrina, as we talk through the original vision of CIT, as I remember, there were 3 elements that struck me the most 20 years ago when I first went to Memphis. One is that you would have a voluntary engagement of law enforcement officers who would self-select for this program and sort of shape the personality of the participants. And you'd look for a 1 in 5 type ratio. Is Phoenix doing that? And is the rest of the country doing that? First question.
I think most of the country, the International Associations of Chiefs of Police put out a One Mind campaign, and a lot of cities signed on. And that campaign was a commitment to training at least 1/5 of the department in CIT. And so I think that's a goal for everyone. Oddly enough, that 1 in 5 number is something Sam just invented because somebody asked him one day, and it's not like a solid thing. So what the city of Phoenix is doing is we're working with our department analysts to do some predictive modeling. Like, how many do you have to have in order to have a CIT officer available for all calls that we can identify as mental health calls, and then aim for that number.
Terrific. So maybe more than 1 in 5 is required to meet the demand that's coming in, and you'll try to get to that. The second element was exactly that 911 would be able to identify the closest available CIT officer, so that when you have a mental health type call, a CIT could be diverted to that scene.
Ooh.
Phoenix is doing that. Is the rest of the country doing that?
Some people say they are. Memphis has always said 100% of the time they get a CIT officer to a CIT call. I can tell you that when staffing is low, that gets hard to do, just because your CIT officers are going to be tied up on regular calls. And so with most police departments in the country having staffing challenges, I imagine that we're slipping a little.
And then the
That's
final
where a
one
dispatch module could be really helpful for sure.
Yeah, that's right. The final one, Sabrina, is that as I remember the original model, once you dispatch that CIT officer to the scene, when they arrived on the scene, regardless of what your local protocol was, let's say your local protocol is the most senior person, the most tenured, the highest whatever, is in command of that scene. But in the Memphis model, it was the CIT officer who would be directing the responsibility for that scene. Is that the case in Phoenix? Is that the case nationally?
That is tricky. That sort of bucks up against a lot of culture and ceremony. It's hard to figure that out through data. Like, you can't datafy that. But I can tell you, in randomly watching body worn camera video, we watch a number of videos where the CIT officer is on scene and assigned a different duty other than communicating.
But this is where, again, those partnerships with academia really make a difference, is they can evaluate different departments with different approaches. And, does it make sense? Do things go better when the CIT officer is in command of behavioral health emergencies? Who knows?
Now that I know it does. So we invented a little metric here in Phoenix to sort of score these body worn camera videos. And most officers are average. They score really well, somewhere around 80%. But the CIT officers will score 85 to 90%. So it's a little bit better.
That's great.
So, John, that brings us to the incredible true tales of Behavioral Health Link.
Oh, David, there's so many true tales. I'm just not sure if you're going to tell any of them today.
Well, let's try. So actually, my first engagement with Crisis was when we took over at Behavioral Health Link the Fulton County Crisis Line, which was housed in the same complex as Fulton County 911. They were down the hall from each other in that public safety complex in downtown Atlanta. And they certainly had IT systems, and it was high tech, but it was 2002. And they had a flip book that they used, and it actually had tabs for different types of emergencies. And they would flip to the protocol for that. And so they had one for mental health. And we looked at that flow chart decision tree together and established some of these same kinds of back and forth protocols, Sabrina, that you were talking about are finally being done between 911 and 988. We did that 22 years ago, John. I remember when we went live, it was August the 2nd of 2002. And one of my call center agents came to me and said that 911 had messed up a call. And I was like, okay, tell me more about that. And they gave me their story. So I said I would call the 911 supervisor and ask them about it. And unfortunately, the story was just that. I at least went into it humbly with, want to talk to you about a situation that had occurred. But I knew I was in trouble when she said, shall we just listen to that call? So, which we did. And I got the truth of our brand new staff learning quickly on the job. But that engagement with the coordination, that orchestration right from the get-go was really critical, John, in understanding. And of course, those protocols and those interactions, they just didn't stick over the course of time. We've not seen those hold. We tend to do these one-offs where we partner with a 911, but there were well over 160 911s in Georgia. And room for opportunity that we systematize these things going forward, John.
I mean, it sounds like something that happened, David, but I don't know. Did it really?
Yeah, it really did, John. Your interactions with 911, Sabrina?
Yeah, I mean that sounded very real.
But do you have an ongoing? Do you know the 911 folks in Phoenix?
Absolutely.
How many 911s do we have? And
in like Arizona or in?
Yeah.
Oh, geez, I don't know a lot.
So, John, that brings us to.
I think it's time for your plain truth, David.
I think it's time for some plain truth. So,
can they handle the truth, David?
Well, here's the reality. And I'm going to bring up the pioneer of a lot of this work that we've been talking about, Major Sam Cochran from the Memphis Police Department, who has been such a pioneer, tenaciously pushing that vision forward. Sabrina called it what was the phrase you used, Sabrina? A blindly applied,
a blindly adopted novelty.
A blindly adopted novelty. What's been adopted is a vestige of the original vision. The original vision was for police to have the tools that would allow them to get a person care and support, not punishment, and allow them to get back to their job of doing the day-to-day of police work, of being a protector of the public safety. And yet, what's actually happened is in most communities, more of a training component that is super helpful, but not the radical transformation that was envisioned. The kind of mobile crisis capabilities, crisis receiving facility drop-off capacity, the staffing capability that Sabrina's talked about. Phoenix is an outlier in having those components. And even here, the degree to which we do that is not where we want it to be. We still have people who are in emergency departments for too long. We have people where police were involved, and we wish we could have done that with mobile or other support. So the day-to-day reality in most communities is that CIT is a training program that helps officers be more prepared. John, we put paint on the house when the original vision was to tear down the house and build a better one.
Yeah.
And the danger for us is the same with 988. The SAMHSA vision of 988 is for someone to call and they are ready and waiting for your text or for your call, and a caring, engaging support is there. That mobile teams can come out in crisis receiving facilities and there's support and care. But we've got to see through that full vision, or the danger is that it's a new branding of the National Suicide Prevention Lifeline and not a wholesale revolution. Now, we're seeing so far very positive steps, but we've got to keep that going. NAMI in Memphis had already identified that police didn't have the training that they should have. And that's when an individual in 1988 was killed by the police in an interaction. And it created the opportunity where Sam's vision and the work of local NAMI, the University of Tennessee in Memphis, and the Shelby County Police and Memphis Police Department were able to take and move a program forward. And we've seen an amazing spread of that heart and soul over the course of time. But the plain truth, team, is we've got to see that vision this time around to the fullness and not allow it to become a marketing component that we feel better about what we're doing. But instead, we really push forward this time. Law enforcement being involved in a call where there's not a public safety risk, there's not obvious involvement of a crime. Medical staff being involved where there's not an obvious physical health medical emergency. These are the practices of the day, and yet they are not where 988's vision takes us. So CIT believed in a world where police would be able to get people the help they needed rapidly and they'd get back to their work. That's not happened yet. And 988 has to be the time that we begin to move all of this dream into our reality.
That is some plain truth, David. And I think it really goes back to what you were talking about earlier, Sabrina, is how important those relationships are. There really has to be a smooth handoff. There has to be an understanding of what those protocols are. And there has to be a commitment towards funding those bridging resources that really allow police who are CIT trained to be able to hand that off very smoothly without losing connection with the individual and making sure that we're resourcing that. I think there's a lot of silos that we're funding this over here and this over here without saying how are they going to work together. So whenever we're funding, there needs to be a crisis resource. There needs to be a piece of that is dedicated to making sure that you're bridging that gap and building the relationships with your partners, just as you do so well, Sabrina.
Well, thank you.
And I mean, that's I think one of the things that you have really brought to your leadership, Sabrina, is hammering home the importance of those partnerships. And it's been so wonderful having you here today, talking about your experience, your passion related to crisis intervention teamwork. And we're just so glad you're able to join us today.
It's great hanging out with you guys.
Yeah. And as for next week, please join us, because we're going to be welcoming the director of SAMHSA's 988 and Behavioral Health Crisis Office, the forever brilliant and charming Monica Johnson. Now, just for now, stay cool, stay anchored, and look out for the lifelines to be tossed your way next week.